Welcome to A Balanced Life on the Go. I'm Dr. Nicole Lindsay, your host on this podcast, along with Dr. Brian Jeanette. This is a podcast designed to help connect you to a more balanced life on the go. Each week, we will bring you simple, concise, and easy to implement ideas, tips, and strategies to help you connect to better nutrition, movement, and thinking so you can achieve balance in your busy life. Isn't this what life is all about? Trying to achieve balance so that we can be healthy, happy, and live to our fullest potential. We're glad you joined us. Let's get started.
Hi everyone, this is Dr. Brian Jeanette here at Back in Balance, and today on this episode of Balanced Life on the Go, we're going to be interviewing a local dentist, Kelly Van Wagenen. She comes to us with a doctorate in dental surgery from the University of Buffalo, and then she went on to complete her residency at East Carolina University's Advanced Education in General Dentistry. So whenever we welcome Dr. Kelly Van Wagenen.
Thank you.
Yeah. So today what we want to really go through on both a chiropractic standpoint and a general dentistry or a dentistry standpoint is how much those two things are connected together. Your oral health is exactly like your spinal health. When one of those goes down, your overall health and your overall quality of life can decrease very drastically. Not taking care of one of these aspects can be a very costly and a very life-changing event that takes place can very quickly get out of hand.
Absolutely.
Right. And both of these, the oral health and the spinal health, really shed light on the overall health status of the person. So today we want to go through, what we do on the chiropractic standpoint with working on temporomandibular joint or TMJ disorders, and what the dentistry world also does with the TMJ disorders that we will see. The first thing that we want to really go through is how a misaligned spine, you can have these subluxations in your spine, and how they affect the posture and how this poor posture can affect your jaw and dental health. Right. So we see it all the time. We're in this 21st century, post-COVID. We're all working remote, working from home, and we have this head forward, shoulders rounded forward. And what this does is this actually forces your jaw to be in a different position. If your jaw's in that position that it's not used to being in for such a long period of time, we start to develop problems. And if we don't take care of these problems, if we don't address the spinal alignment, we can negatively impact the jaw. On the flip side of that, those of us that have, either we're unlucky enough to be born with jaw issues, or we're getting some sort of accident or some sort of trauma, or just have bad teeth,
Yep.
I guess.
We can go with that.
Go with that, yeah. Really can change that jaw alignment, forcing your body to adapt to that, and to force you to have to be in different positions, to open your mouth, to chew, to breathe, even pain-free.
Speaking and, yeah.
Mm-hmm. So we want to go through what percentage of the population, or what population this most commonly affects. So, Dr. Van Wagenen, what do you think you have the most patients coming into the office with the TMJ disorders?
So it's primarily going to affect women. We'll see it ages 20 to 50 for the majority, but it can affect men and women. It can affect all ages. That's just shown to be the highest percentage there. We'll see a similar presentations where we can have any type of clicking or crackling crepitus in the jaw joints, so those sounds.
Do they come in there and say, like, when I do this, it like clicks and cracks?
Yep, absolutely.
Yeah.
And we can associate clicking, cracking, any sounds can have an adaptation where there's not pain associated with it. That does tell us that something has happened in the joint, but the body's been able to adapt to it. But we do want to recognize those sounds.
Say that again. There's something going on with the body, but up to this point, it's been able to adapt.
Absolutely.
So does that mean that probably at a certain point in time, your body's no longer going to be able to adapt?
It can absolutely mean that, yep. So it's important to address it before it becomes a chronic problem.
The dentistry world has captured the U.S., maybe in the world, population how important it is to take care of your teeth and take care of your oral health. But you guys have it down pat with making sure that your patients perform maintenance on their teeth, on their oral cavity to stop these things from happening. Whatever the dentistry world did, we need to take note of it. I think that's so powerful what you just said with these adaptations occur, changes occur, and then your body adapts to that. But then most likely at some point your body's not going to handle that adaptation anymore, right? One of the reasons, several of the reasons why we have these adaptations in the first place is kind of a laundry list of changes that take place or events in our life that take place. First and foremost, it's our lifestyle, right? I don't know about you, but when you went to school, did they ever like put fingernails underneath a microscope and you like look at all the bacteria that's underneath like your fingernail and it's like rampant? So actually, maybe not surprisingly, one of the major things that can cause jaw issues is nail biting, right? Nail biting. Secondary to that would be poor physical fitness. You know, it really takes, you know, we talk, if you've ever been in the office with me and you've ever worked with me, you know that I talk a lot. So my jaw's constantly moving. If we don't have enough fitness status in our jaw, in our neck, and our upper shoulder muscles that are allowing us to support all the work that we do, we can have a really kind of major problem.
Inadequate sleep is something that's really can contribute. We'll see, you know, I feel like a lot of the population has difficulty sleeping, staying asleep, getting quality sleep, and that can lead to decrease in pain tolerance. It can lead to chronic inflammation in your body, and so you'll hear us talk a lot about inflammation, and with TMD, it's inflammation. So if we can decrease the inflammation, we can help to avoid or decrease long term.
Absolutely. One of the questions that I have about sleep as it relates to oral health is, with lack of sleep, do you see an increased prevalence of tooth decay or like gum disease from?
You can, because you're not taking care of your body. Your body's fighting some other part in your immune system to be able to try to keep up with all these other things that are happening. And unfortunately, it can change how your oral health can respond to having almost an attack from bacteria or acids. So we'll see all of that combined.
Yeah. One of the things that I think the dentistry world has done a really good job of is instilling toothbrushing or teeth brushing, right? Because everything in your environment is going to contact your mouth at some point. We can all wash our hands as much as we possibly can, use all the hand sanitizer we can as much as we possibly can, but you're going to have some sort of bacteria anywhere that you're in your car, the house, work, whatever, and it actually gets into your mouth. It's this bacteria that we come in contact with, or it's food, right? Or it's food.
And we naturally have bacteria in our mouth as well, so it's a matter of getting the balance of good bacteria versus bad bacteria. And when we have chronic inflammation, it decreases our ability to fight that bad bacteria off.
When you have too much bacteria in your mouth, what does that cause and what's that lead to?
So everything from tooth decay, gum disease, we can see changes in, patients will complain of bad breath.
Not just coffee breath, but actually bad breath.
Yeah, just because the bacteria changes and it's able to stay there more easily.
And then over a period of time, that ends up wearing away of the enamel or the actual bone structure.
Yeah, absolutely. Yeah. So the tooth layers that are there, the outer layer is very strong to begin with. And if you're giving it the proper nutrition to the outer layer of the tooth with brushing properly with the right ingredients, then it can help to continue to strengthen that tooth surface. But with bacteria and acids, it will start to wear down that tooth surface, and with tooth wear over time, can actually change how your bite comes together.
Everything that you just said, again, just sounds so much like chiropractic care and how it impacts the spine. You have these increased levels of acidity in your mouth, where you're not breaking down as much of the food as you need to, or you're breaking down too much of it. You end up becoming malnourished, and your body doesn't have the ability to absorb all the nutrients or all the minerals that it needs to absorb, right? And this inevitably will lead to bone decay, and in our case, spinal decay as well.
And it's something that can start so small, right? And if it's not addressed, it will just progress, and a lot more things will become involved over time.
It's the snowball effect. Another cause that we want to go through that we won't touch too much on, but is so super important in this day and age, is some of these psychosocial factors that matter. Stress, right? We're under so much stress, and you don't realize how you get angry, you're stressed out about like a deadline at work, and you're just clenching your teeth, and then all of a sudden your teeth hurt, or the muscles around your jaw hurt, right?
Yep, and we've seen in dentists in the community, we've seen an increase in TMD cases with COVID, with life is so stressful now. COVID especially, we saw an increase in the inflammatory factors. People are stressed. They either notice that they're clenching during the daytime, or they'll wake up in the morning feeling like they've been working out their jaw muscles all night long while they've been trying to sleep.
Yeah. And that's so fascinating, because we've honestly seen the same thing as well. Another cause that we haven't necessarily discussed is diet and nutrition. Through the course of our human existence, we typically eat less refined, more raw types of foods. At some point in our community, we've decided that a lot of time it's best to go on a liquid diet, or we consume our calories, or we drink our calories, right? Well, in this case, we're not actually chewing or using the proper mastication or eating muscles. We don't spend as much time strengthening the jaw and moving the jaw in the ways that it's actually designed to move. And that's a whole other dentistry topic, where we actually see the hard palate narrow, getting smaller. We start to see the teeth getting more crowded together. We start to see the actual airways getting smaller, and that leads to a whole host of other health issues, right? But that's a podcast for another day. And a lot of times these disorders that we experience in the TMJ itself come from the muscles. So we want to go through a little bit, just kind of a surface level anatomy of the TMJ and how the issues in the TMJ happen. So if we take our hand and we put like a little inverted C or cup right here, this cup is the joint that's attached to our jaw right here. That's attached like our skull. And our jaw has a connection point that wraps up and goes into this cavity that's right here. Well, inside that cavity we have muscles, we have tendons that's attached to it, we have ligaments that's attached to it, and we also have a disc that's attached to it. It's one of the only places in your body where you have the same disc material that's in your spine, that's in your jaw. And that's actually why it's so painful. These things hurt when we have problems.
And there's nerve fibers that can get irritated within the joint itself as well when it's not in the proper positioning.
So when everything is functioning and moving like it should, what we should experience is, as we open, that the jaw itself should roll and pop out and then come back in. And this thing should happen very, very smoothly, right? The majority of the time when we have these disorders, what happens is your disc actually shoots with it and it pinches together. So like Dr. Van Wagenen was talking about with the nerve fibers, well, if that disc is moving when it's not supposed to move, you're pinching those nerve fibers together, and gosh, it hurts. And then I'm sure everybody that's experienced TMJ disorder has stopped in their tracks.
Absolutely.
When you open your jaw and you have that electric sensation, you lose your appetite.
Real quick.
Really,
we have to think of it too that you have two joints, they're on each side, so they need to be working together to be able to have that motion happening. So if one side isn't working properly and the other side is trying to, they can end up just becoming uneven. You can have degeneration on one side more than the other, but they really need to be working in tandem to be able to be functioning properly for the jaw.
Absolutely. And if they're not working in tandem, oftentimes what's happening is one muscle is working harder than the other muscle. We have a whole series of muscles that are in our jaw, on our face, inside our jaw. That is, I can't even pronounce those. Dr. Van Wagenen's the professional on those, and we'll touch on those later. But those muscles are so important for just in general optimal functioning of the jaw. Another cause of the TMJ disorders is joint arthritis, right? we can get joint arthritis, and this happens from age. It's just kind of a normal progression of utilization, a normal progression of aging. We can get it from the muscles that are restricted, right? We get a trigger point on one side, it's not allowing that jaw to open up as much on this side, and so then you got one going really wide and then one going not as wide. Right.
We can have things like any autoimmune disorder, so rheumatoid arthritis is a big one that can affect your jaw joints, where it can cause breakdown on the surface of the joint. So like you were discussing earlier, that it's a fluid, smooth movement that's happening. When arthritis breaks down that joint function, it's actually going to be sharper surfaces that need to work over each other. So they'll be bumpy instead of having that gliding motion that should be there.
It just like hurts, like thinking about it. Trauma. We've all seen cases of car accidents where they break their jaw, where somebody has a slip and fall, or even sports injuries. Then they start to wire your jaw shut, and we won't even get into all the issues that happens with that.
Those are some of the more extreme cases. I've seen patients. It's as easy as your dog or your toddler just hitting up against your chin too hard. And that causes that extra pressure on the joint that it's just not used to having.
Sounds terrible. And the last one is actually specific cervical or thoracic dysfunction. Everything in our body works in unison, and if one thing is out of sync, it's going to put more stress and strain on other parts of your body. So as you turn your head left, turn your head right, turn your head in these directions, look up, look down, your spine should rotate and roll. And if it doesn't, what it's going to do is put more stress and strain on your body. So if I don't have enough cervical function in an optimal or normal manner, that's going to put that force through the jaw. And why it puts it through the jaw is because we have so much musculature in the upper part of our body that's connected to the jaw that goes all the way down. And we touched a little bit on some of the muscles that are in the actual jaw itself, but we have just as many muscles that attach to the underside or the bottom of the jaw that go to the top of the shoulders. And so if these aren't working properly, we're going to feel it somewhere else in our body. Even walking. Now, really interesting fact that I think about the TMJ or the jaw itself is whenever we are walking and we heel strike, and this is just a normal walk, and we hit that heel on the ground, we're putting half of our body weight through our jaw joint itself. That's why a lot of people don't want to walk that fast or even run when they have TMJ issues, because we're constantly pounding on that jaw. So if we have improper mechanics while running and we're putting 3 or 4 times the amount of body weight into the ground or into our jaw, we can really start to see how we then set the stage for trauma, how we set the stage for myofascial restrictions or these trigger points, how we set the stage for muscle imbalances. It's all, everything works in harmony together. Right.
And that, touching on that as well, so just when your normal function as far as just walking around everyday life, there's certain positions that your jaw should naturally be resting in. So we've talked about how breathing through your nose is so important, where nasal breathing will help to keep everything in proper alignment. Your tongue should be positioned in a certain way during the daytime. Your teeth shouldn't always be coming together. So if you are someone who is walking around stress clenching during the daytime, you're just putting so much extra force than what the joints are made for.
Should your teeth ever come together, like when you're resting?
No, I mean, they really should have that separation.
There's always a little bit of space that's happening. Got it. And then some of the other structural change that we've already talked about. We talked about your jaw having a disc, and if you have a disc placement where that disc actually moves, like we have like damage or repetitive use that happens, that's where we start to get a lot of the painful symptoms that happen in there. And then in the dentistry world, Dr. Van Wagenen's, kind of bread and butter are these malocclusions. She's already touched on that, where how your teeth should approximate together. Should they touch? Should they not touch? Are they deviated to the left? Deviated to the right? And proper development of that jaw. And again, that's a whole other series of podcasts with proper jaw development. With babies sucking on their thumbs or like pacifiers or something like that. That's a whole other.
Yeah. One of the important things to keep in mind. So we'll see. At times, patients who have come in who have done at-home orthodontic treatment. So trying to have aligners done themselves, where we end up where the teeth may look good, but they aren't functioning properly. The bite isn't been made to be in the proper dimensions, where it should be coming together. So it may be okay in the beginning, but we'll get those early stages of discomfort, which will eventually lead to that chronic discomfort.
I hate that, because orthodontics is such an important part of our development, and for a lot of people it's so important because of all these factors that we talked about, because of the stress that we put ourselves through. I mean, younger and younger kids are going through much more high levels of stress and high levels of anxiety, whether it's school or whether it's social life or sports. And we're just now seeing changes in jaw development, and kids having to go through 2 stages of orthodontics instead of like when I was 12. I had like a year of orthodontics and I was done with it. Now we're seeing kids with 4 and 5 years of orthodontics, and I can only imagine that's because we're seeing a decreased trend in dental health.
Absolutely.
Right. So now we want to talk about when you come to our office with these problems, how are we going to evaluate you and how are we going to treat you? On the chiropractic side, what we're going to look at is we're going to look at your spinal structure. We're going to take some x-rays of your spine, potentially if they're warranted. We're going to take x-rays of your cervical spine and x-rays of your thoracic spine. We're going to take you through observable range of motion. How well do you open and close your jaw? How well does your cervical spine or your neck move? How well does your middle back move? And we're going to put all of those together to see where the problem may arise from. There's also specialized orthopedic tests that we can do to really see if it's a very, very specific internalized joint problem, or if it's just a muscle kind of trigger point thing. Yeah.
And then on our end, for our evaluation, we'll start with a dental history. So we'll ask our patients if they've had any history of trauma, any history of their jaw getting locked, opened, or closed, if they've had any crowns or extractions, teeth removed because they've had fractures of their teeth. These are all things that tell us that they're at a high risk for having TMJ dysfunction. If they have fatigue where they cannot chew gum or cannot stay open for an entire dental appointment, those are all things that we are on the lookout for. We then do a muscle and joint evaluation. So this is kind of what we were talking about earlier we're evaluating for any sounds, any pain with those sounds. We'll evaluate to see if there are any discomforts upon palpation. So what that is pressing on certain points where we have the masseter muscle that comes here, the temporalis muscle in your head, and then the pterygoids are internal. So these are the 3 main muscle groups that we'll evaluate for, and any tenderness to this pressure point tells us that there's inflammation within that muscle. There's the pain fibers that are in the muscle are firing off when there's inflammation present. We'll also do the oral exam where we take a look to see if there are any current fractures, cracks in the teeth. We'll do x-rays to see the joint itself to see if there's any arthritic changes over time. So maintenance evaluation of x-rays is really important over time as well. One thing that kind of sticks out a lot is we'll have patients that will come in with saying they have sensitive teeth, but we can't really either target a certain tooth or the tooth itself doesn't have anything clinically wrong with it. And we'll see this often with clenching where we're just putting extra forces on those teeth, and if we can relieve those forces, then we can relieve the pain that's present.
Is that what bruxism is?
Mm-hmm.
Like that?
Any type of parafunction. So anything that's functioning how it shouldn't be. So if we should be functioning properly with chewing, speaking, but bruxism is when we are grinding our teeth or clenching our teeth, using our jaw muscles in any way that it's not meant to be on a normal basis.
My child grinds his teeth, and it's the most disconcerting sound ever.
Oh yeah. Mm. And one thing that we look out for too, especially in children, is airway. So that's something that we do an evaluation for, where if there are any airway concerns, where sleep apnea has a high correlation to bruxism. So that's something that we are on the lookout for as well, especially in kids.
And these things again, are starting earlier and earlier in life. Malocclusion with the jaw, not developing the proper jaw muscle and jaw strength, and then even being overweight, even having poor nutrition or poor diet. These softer, more highly processed foods are not allowing us to develop the correct jaw musculature that we need just to function normal, right?
Absolutely.
When we talk about treatments for TMJ disorders, I also want to add that everybody has a TMJ, but not everybody has TMJD, or temporomandibular joint disorders. So it's important that we add that last piece of that puzzle, which is talking about having the disorder that's associated with it. Because we can't treat a TMJ, but we can treat a TMJ disorder. One of the major thing that a chiropractor is going to do inside the office is adjust you. We have to adjust your spine. We have to make sure that the actual joints themselves are moving in a fluid, proper manner, proper motion. So through the course of our evaluation, we are going to assess the cervical spine and the thoracic spine to make sure that is functioning normal, or that those joints or vertebra are moving optimally. After we do that, we're going to assess the TMJ joint directly, or the temporomandibular joint directly. We're going to see how well are those jaws, or those hinges opening. Are they opening at the same rate? Is one opening faster than the other? Is one not even opening at all? Or can we actually feel that like pop dislocation that's taking place? Or if those are fine, is your jaw moving left or right when you're opening it? Or is it moving left or right when it's closing? You know, you might open your jaw and it opens normally, but then when you close it, it does this big like C curve that goes up to the left. It like shuts off to the left and comes back up normal. Like, what the heck is that? So we're going to be assessing all these things, and when we assess these things, it's going to tell us the direction at which we should adjust the jaw. And the reason why we will adjust the jaw is because that jaw structure, like I've already said, is very, very similar to the spinal structure. It has an opening and closing joint. It should move in a way that is normal and optimal for that particular joint itself. And it has a disc. And that disc is very, very painful. So when you clench down on that disc, it becomes very, very painful. After that adjustment, if we find that we actually have trigger points in the surrounding areas, whether on the outside or the inside, we will do soft tissue work on that outside and inside. This intraoral myofascial therapy is so incredibly effective for TMJ. A lot of the times, our TMJ disorder patients are going to come in with simple muscle imbalances. You know, if they have fractures, they have all that stuff. That's out of our scope of practice, and we're going to send them down the road to Zoe Dental. But working on the musculature on the inside can really, really change how these patients open and close their jaw. Along with that, we're going to give exercises. And we'll give a series of exercises that are going to be in order to strengthen the neck, strengthen the front portion of the neck, strengthen the back portion of the neck, and then different protocols that are designed to strengthen each individual muscle group that's in the jaw. And then we're going to talk about lifestyle changes. You know, in the short term, we're going to discuss stopping eating these foods that are bothersome. You know, avoid chewing gum, crunching down on hard mints, even hard candies, for example. Maybe even like, you know, hamburgers. You know, some of these days you go to like Farm Burger or something, you get this hamburger that's like this thick, and you try and like shove the whole thing in your mouth. These are things that we have to really, really be concerned with. And then we'll work on, you know, different breathing techniques. You know, these breathing techniques are super important. Like Dr. Wagenen was talking about sleep apnea, making sure that your jaw is resting in a proper position. It should be intuitive, but we all forget how our jaw is supposed to hang off our face. Right? We all don't know where our tongue is supposed to sit inside of our mouth. And so retraining these factors that are going to take stress away from the jaw joint is incredibly important.
I love how you talked about, you know, what you do in office to address the acute problem, but then how important it is to make these lifestyle changes at home, because it's similar to you come in for your cleanings twice a year if that's what's indicated, but you still need to brush your teeth at home, right? So it's just like coming in here, we need adjustments, but then we still need to do our home exercises to maintain.
Yeah, no one can do it all for you. You can't expect to stay fresh and clean your entire life. I mean, everything requires maintenance. Everything requires discipline from the individual to stay functioning properly. Whether we use the example of dentistry all the time. You brush your teeth. You have to brush your teeth every single day in order to keep them healthy. Or use the example of going to the gym. You can't go to the gym once and expect to look like Arnold Schwarzenegger. You can't cut your grass once and expect it to stay looking beautiful the entire time.
Right.
Things get out of control very, very quickly. Whether it's cavities, plaque on your teeth, oral hygiene, or spinal hygiene.
As far as what we offer for treatment in our office, so typically the first line of treatment for anyone that has TMD disorders especially with the muscles, is to have a custom night guard made. It's so important for acute care, but then also for maintenance to be wearing this night guard. So oftentimes patients will be clenching during the nighttime when they're sleeping and can't control that. It's something that your body does. It's a biofeedback mechanism, but we need to kind of interrupt that feedback with a night guard. The way the custom night guard is made versus something that you would get over the counter, it's made with a ramp on the front of it so that your back teeth aren't touching when you're closed together. Our teeth have a ligament around them, and these ligaments will send messages to your brain to activate the muscle functioning. So the back teeth have that highest level of feedback to our brains, so it will give the highest level of contraction to these muscles.
Say it louder for the people in the back. That is how the entire body works. That's like you just discussed, like the major underlying scientific premise of chiropractic care. Everything communicates to your brain. And if you're doing something that is not allowing communication to your brain forgets about it.
Yep.
And then it goes awry.
Augments to whatever it needs to do. Yep.
That is it.
Another treatment option that we have with Dr. Olofsky in our office is Botox. So what he would do as a trained dentist for this is to inject the Botox strategically into the muscles that are responsible for the jaw movement, and that helps to reduce muscle tension and alleviate pain. It does this by temporarily blocking the nerve signals that trigger muscle contractions, and you can see a noticeable decrease in jaw clenching and grinding. So one of the really cool things we can see as well with Botox use and custom night guards is a decrease in muscle size sometimes. So when you work out, you're going to be doing bicep curls on both sides, right? You're not going to do 20 on one side and 2 on the other, right?
Right.
But if you did, you can imagine one side would be a larger muscle. So we'll see patients sometimes that will come in with a visibly larger muscle on one side, and you can see those visible changes over time where the muscles actually decrease back to the size they should be. It's amazing to see that change, and as quickly as it happens too.
Do you use Botox for, what kind of cases do you use that for? Like really severe cases, or?
They can be any range of levels. So the important thing with Botox is to have the assessment done with Dr. Olofsky to ensure you are a good candidate for it, but it can treat all levels of severity, but it's also something that needs to be maintained over time. So it's not just one treatment that's done. This is a maintenance program for it.
Mm-hmm. Interesting. Very cool.
The other thing that we offer, so it's really important, as we talked about, is to address any acute instances of flare-ups or first onset of any signs of inflammation. So we can make a temporary night guard, prescribe anti-inflammatories, prescribe a soft diet, again, so something that doesn't require a lot of movement of the mandible during this acute phase, and then have patients wear hot or cold compress, whichever feels better. We can prescribe muscle relaxers, and those can be especially useful. Yeah, absolutely.
Didn't know that.
Yeah, they're useful, especially in chronic patients that are very aware that they know if they come in and have some dental treatment done that's going to take a long time, they know they're going to have a flare-up happen. So we may prescribe the muscle relaxer before and after that appointment to help avoid that flare-up.
Interesting. That's cool.
Yeah. Another thing we'll look for is if we need to do what's called an equilibrium. So we'll adjust the top surfaces of the teeth or have new restorations made so that the bite can come together properly. And finally, if we aren't seeing something that should be treated in any of those manners, we'll refer to physical therapy, to chiropractic care, or we have TMD specialists in the area. There are a few in the area that are wonderful. Typically, they're oral surgeons that have had advanced training on how to treat within the joint itself.
That there's so much that we can do for temporomandibular joint disorders. They are so painful and they're so disruptive to life. If you or if anybody you know that's suffering from TMJ disorders, please feel free to give our office a call, Back and Bounce. Again, we work with Dr. Van Wagenen all the time with Zoe Dental. Her and her team of dentists are highly trained to handle a lot of these problems. And oftentimes the most severe cases require co-management of care. Yeah. So it's not a one-stop shop this is not a one-stop problem for most people. You have to really hit this problem from multiple areas. So I thank you guys for listening. Again, thank you, Dr. Kelly Van Wagenen, for taking some time with us. And hope you guys have a good one.
Thank you. Have a good day.